Ever wondered if there's a connection between vitamin D and multiple sclerosis? This is a question that has intrigued medical professionals and researchers alike for many years. To provide some context, let's first look at what multiple sclerosis, often referred to as MS, actually is. MS is a condition characterized by a series of rather daunting-sounding terms: inflammation, demyelination, axonal or neuronal loss, and astrocytic gliosis. In simpler terms, it's a disease that affects the central nervous system, which includes the brain and spinal cord. This in turn can lead to varying levels of disability, depending on the severity of the condition. But where does vitamin D come into the picture, you ask? Well, there's been a growing body of evidence that suggests an association between MS and low levels of vitamin D. This means that people with MS often have lower vitamin D levels compared to those without the condition. Now, vitamin D is typically known for its role in promoting healthy bones, but it's also crucial for a well-functioning immune system, which is particularly relevant when discussing MS. This is because MS is an autoimmune disease where the immune system mistakenly attacks the body's own tissues. So, the hypothesis is that perhaps by supplementing with vitamin D we might be able to manage or even reduce the disease activity in people with MS. This potential benefit has been the focus of numerous scientific studies and reviews. The aim is to evaluate not just the benefits but also the safety of vitamin D supplementation in people with MS. Researchers have used various methods to investigate this, including comprehensive electronic database searches and hand searches of relevant journals, abstract books from conferences, and more. But what's the verdict? Does vitamin D supplementation actually help manage MS? Or is it just a theory yet to be proven? Well, the answer is not as straightforward as we might hope. To truly understand, we have to dive deep into the research findings. So what does the science actually say about this connection? Let's dive into the research. The primary objective of this review was to evaluate the benefit and safety of vitamin D supplementation for reducing disease activity in people with multiple sclerosis. To achieve this objective, the researchers implemented a stringent methodological approach. They conducted a comprehensive search of the Cochrane Multiple Sclerosis and Rare Diseases database, using search terms relevant to the review. This search was supplemented by hand searches of relevant journals and abstract books from conferences. The inclusion criteria for the studies were quite specific. The researchers included randomized controlled trials and quasi-randomized controlled trials that compared vitamin D supplementation versus placebo, routine care, or low doses of vitamin D in patients with MS. Vitamin D was administered as monotherapy or in combination with calcium. The researchers also allowed concomitant interventions, provided they were used equally in all trial intervention groups. Once the relevant studies had been identified, 2 review authors independently extracted the data and assessed the methodological quality of the studies. This process was crucial to ensure the accuracy and reliability of the findings. Any disagreements between the 2 review authors were resolved by a third author, ensuring a balanced and unbiased assessment. In total, 12 randomized controlled trials involving 933 participants with multiple sclerosis were identified. Of these, 464 were randomized to the vitamin D group and 469 to the comparator group. The trials tested both vitamin D2 and D3, but the majority focused on vitamin D3. With that clear, what were the actual findings of the review? After a 52-week follow-up, the researchers found that vitamin D3 supplementation had no significant effect on the annualized relapse rate, the expanded disability status scale, and MRI lesions. In other words, the progression and severity of MS symptoms and the number of new active lesions in the central nervous system were not significantly impacted by the intake of vitamin D3. Now let's talk about safety. The research showed that vitamin D3 did not increase the risk of serious or minor adverse effects within follow-up periods ranging from 26 to 96 weeks. This is an important point as it means that vitamin D supplementation, at least in the doses and durations used in these trials, appears to be safe for people with MS. The effects of vitamin D on health-related quality of life and fatigue, however, are less clear. 3 studies that used different quality of life scales reported varied results. One study found that vitamin D improved the psychological and social aspects of quality of life, but not the physical aspects. The other 2 studies found no significant effect of vitamin D on quality of life. Similarly, 2 studies reported on fatigue, with one suggesting that vitamin D3 reduced fatigue at 26 weeks follow-up, while the other found no effect at 96 weeks follow-up. Furthermore, 7 studies reported on cytokine levels, 4 on T lymphocyte proliferation, and 1 on matrix metalloproteinase levels, but no consistent pattern of change in these immunological outcomes was observed. Given these results, what conclusions did the researchers draw? Well, the study suggests, albeit based on very low-quality evidence, that there's no significant benefit of vitamin D supplementation for outcomes that are important to those with multiple sclerosis. This means that while vitamin D appears to be safe for use, its effect on the recurrence of relapse, worsening of disability, and MRI lesions is, at this time, unclear. It's important to note that these findings don't entirely rule out vitamin D as a potential aid in managing MS, but they do highlight the need for further, more comprehensive studies. Remember, science is a process of constant discovery, and today's uncertainties can be tomorrow's breakthroughs. As always, research continues, and we look forward to more studies that can shed further light on this topic. Until then, stay curious, stay informed.